And we're talking more about safety right now, and we want to talk about preventable deaths and a commitment to trying to reduce them. Some New Haven doctors are among the first in the country to work towards this goal in the coming years. And Dr. Keith Ruskin is a professor of anesthesiology and neurosurgery with the Yale University School of Medicine. He joins us now to talk a little bit more about it. Good to see you, Doctor. How are you?
Thank you for having me. Very good, thanks.
Let's talk about preventable deaths. What exactly are we talking about?
So preventable death is a death that could be prevented, just what it sounds like. So somebody that comes into the hospital or comes into medical care, but because of a medical mistake or a problem with the technology or a hospital-acquired infection, dies.
Okay.
And that's what we're trying to prevent.
Yeah, so talk about what are some of the things you're doing to try to prevent these preventable deaths. So I said that right. Yeah.
So one of the things that we're doing is I'm part of a Patient Safety Movement Foundation. And this is a group, it's a fantastic effort, and it brings together doctors of all specialties, nurses, hospital CEOs, industry representatives, a whole series of people. And the idea behind this is all these people are going to come together in California next month along with U.S. senators and past U.S. presidents to work together to try to get to a goal of 0 preventable deaths by the year 2020.
And you're talking about when somebody goes into the hospital, making sure that they don't die unnecessarily, I suppose,
exactly,
for lack
yeah.
of a better term.
So one of the things that we're doing is my area of expertise. What I like to talk about is judgment and decision making. So we've developed some unique programs. We've got a patient simulator, and we use these tools to teach residents and other physicians how to make decisions quickly under pressure and how to step outside their own thought process and look inward to make sure that they're making the right decision. We're also working on new kinds of monitors. So at several hospitals around the country now, they monitor the patients for respiration and blood oxygen levels for the entire time they're admitted.
Okay.
Another thing that we're doing is we're using these monitors to reduce unnecessary transfusions. You know, transfusions were ranked as one of the top 5 overused procedures at a recent meeting of the Joint Commission, which accredits hospitals. And so we've just purchased some new monitors that we're using that allow us to continuously monitor how much hemoglobin, which is what's carried in red blood cells, a patient has during their entire operation, and guides us in this effort.
And you brought us a monitor. We're looking at it on the screen right now. How would something like this work? You hook this obviously up to the patient.
So this gets hooked up to the patient. This is actually one that's designed for patient's bedside. This is brand new. This just was cleared in the United States 2 months ago. So this just became available. And this monitors respiration, and it monitors heart rate, blood oxygen level, and hemoglobin level. The interesting thing about this monitor is that it does it continuously, and it's designed so that somebody who's looking at it can tell at a glance that there's something wrong. It's not connected to a patient now, but if it were, all of the organ systems that are working well would be green, and if there were an alarm condition, that organ system would turn red on that little picture you saw.
And are these all over the country, these monitors?
Starting to be.
Yeah.
We're just, again, we have there's a little inset part that's what we use in the operating room. And those are available. We bought them several months ago. This one that you're seeing here is brand new. The company just released it a couple of months ago.
Sure. So what's the ultimate goal?
Well, the ultimate goal is to have 0 preventable deaths by the year 2020.
And you think that can happen?
I'd like to think so. I always tell people, I've been doing patient safety now for several decades, and I still think that I'm just at the beginning. There's so much more to do, and yet people are coming together, and the really rewarding thing about this movement and patient safety in general is you see people across all specialties and across all professions coming together for this one goal that we all agree with. Again, I believe that 1 preventable patient death is 1 too many.
Yeah, well, it would certainly be great if you can reach that goal. Dr. Keith Ruskin with Yale. Good to see you, Doctor.
Thank you very much.
Thank you so much for coming on the show, bringing this machinery with you. Appreciate that.